欢迎回到时事大家谈，我是叶凡。乌克兰在抵抗俄罗斯入侵的同时，还面临新冠和小儿麻痹症等传染病的威胁。几天前，乌克兰的奥密克戎感染人数刚刚创下纪录，现在避难人群拥挤在地铁站和庇护所，或者搭乘火车逃往邻国。战争阴云下，几乎没有人戴口罩，也没有社交距离。卫生专家担心，一场新的公共卫生危机一触即发。那这场武装冲突如何影响疫情的传播？被称为第三军的传染病会造成多大的平民伤亡？随着难民涌入邻国，地区性疫情爆发和病毒变异的风险有多大？今天我们邀请乔治城大学传染病专家、医疗产品获取安全和管理中心主任杰西·古德曼来分析和点评。Thank you so much, Dr. Goodman, for being here.
Happy to join you.
Russia's invasion of Ukraine may increase the spread of COVID-19, polio, and other infectious disease as people pack the roads, trains, and shelters. Given Ukraine's only has 1/3 of population is fully vaccinated, Dr. Goodman, how dangerous is the situation?
Well, I do think it is quite a serious situation in terms of the spread of COVID and other infectious diseases. You have a wartime situation where people, as you noted, are being crowded together, not just in trains as they leave, but in shelters as they try to protect themselves from the war and the bombing. So it's really a situation where people are being brought close together. Their minds are on other things, their own survival and that of their family. And the attention paid to spread of infectious diseases is going to be a lot less and the risks a lot higher.
And it's understandably that people are now wearing face masks. And also Russia's invasion is also likely to hurt Ukraine's ability to track the virus as people also put COVID prevention to the back burner. Since Omicron infection is most mildly or asymptomatic, how difficult is it to assess COVID increase in real time?
Well, we're already hearing how stressed the healthcare system is in Ukraine, just taking care of injuries, dealing with getting life-saving supplies of medicine, like we've heard that there are oxygen shortages. So I think when you can't take care of those most critical things, the other important things like routine disease surveillance, outbreak containment become even more challenging. So I do think it's going to be hard to track the COVID outbreak. As you say, many cases are asymptomatic, and attention is going to be fastened on the much more serious problems they're facing, the injuries, the threats from war. But we will see an erosion of the containment of COVID and other infectious diseases, and it will place the population at additional risk.
WHO has warned Ukraine's hospitals could run out of oxygen supplies as Russia's invasion disrupts transportation across the country and putting thousands of more lives at risk. Do you expect the death toll to increase?
Well, I think if we can't have essential medical supplies like oxygen reach places in the Ukraine where they're desperately needed, then obviously the toll from many diseases, whether it's from war-related trauma, all the illnesses that will still go on during the war that require oxygen, situations like childbirth, heart attacks, and all the things like that, we will see even more death and injury as the health system is stressed. Obviously, the people are showing incredible resilience and courage, and I expect that will help mitigate some of these challenges. But still, when you have a war, the things that are not immediate and don't demand your immediate attention, and the supply chain, as we've seen, can cause real problems.
The conflict may also spread COVID-19 to other countries as people are fleeing to Poland, Hungary, Slovakia, Romania, and Moldova. Do you expect to see another surge of COVID-19 in those countries?
Well, I think many countries in the region, including Ukraine, had finally started to see their case numbers go down from this recent Omicron wave. And I do think as we bring large numbers of people together and mix different populations, again, the risk for spread of COVID and frankly, other infectious diseases, will increase. And then, we've seen tremendous generosity so far on the part of many countries in receiving these refugees, but still, initially at least, they're going to be in crowded situations where refugees are processed. Destinations are found for them. And as we know from so many similar tragic scenes we've seen over the years, these refugee situations are ones in which there can be a lot of spread of infectious diseases that we haven't talked about yet. But, if critical infrastructure in Ukraine is hurt, for example, a safe water supply, sanitation, that can pose a whole bunch of other risks for spread of diseases that can be spread through sewage and lack of good water. So it's also going to be very critical for Ukraine and hopefully the international community to support Ukraine to protect its critical infrastructure like power, water, to really prevent this from being even more of a humanitarian disaster.
In your view, how would the war there impact the global efforts to end the COVID-19?
Well, I think it certainly can't help. I think there are two big things it's going to do. It is creating circumstances locally where a virus can spread. We don't know where the next variant will come from, but whether it comes from somewhere else in the world or that region, it's sort of mixing many people together from many different places can contribute to spread. And then additionally, the entire world is, distracted from what we were all hoping to be a phase of beginning to get more and more people vaccinated and to have containment of the impact of COVID. And I think the sort of use of resources for things like wars and the attention to it will potentially distract from attention to continuing work to end the COVID outbreak. I hope not. I think the world can do both at once, but it's a very challenging situation to deal with a global pandemic and then suddenly now a war in Europe.
The other issue is Ukraine has been trying to control a polio outbreak since last October. Dr. Goodman, how difficult is it to contain the transmission of polio? Are you worried?
Well, I am concerned. It wasn't a major outbreak. There was one case of polio and several other people were found to have been exposed to or be excreting the virus. But what you need to do to contain those situations is get people in those areas fully vaccinated. So I don't personally know how much progress was made in that in the last couple of months, but I would be very concerned that in that region of the country, I believe was the Northwest, that efforts to get all children and ensure they're fully vaccinated, those must continue. And again, for those to be disrupted by war or failures of the public health system could be a real tragedy. I mean, we really are trying to eradicate polio globally, and it would be just awful if the disruption from the war got in the way of those efforts to contain, a very small potential outbreak in the Ukraine.
So another COVID outbreak or infectious disease outbreak combined with the increasing number of people injured in the war would further strain Ukraine's already stretched health system. So how would that affect people with conditions such as diabetes, cancers to get treatment?
Well, again, clearly in a situation where either the health system is struggling to function, which is often the case in a war, or where there are supply problems, or where people feel unsafe to leave wherever they are sheltering, we can anticipate that people with chronic diseases, particularly elderly, children, et cetera, people who are already not healthy are going to be the most affected by shortcomings in the health system. So this puts everyone at risk, not just from the injuries, not just from the outbreaks, but from this very disruption, of the fabric of society and healthcare in general. So, it is a very dangerous situation, both for people who are directly affected by the war, but also for the whole nation that is indirectly affected by the war.
Dr. Goodman, last question. How would the world do to help in terms of humanitarian aid to Ukraine?
Well, it's been, really gratifying to see the outpouring of support for the people of Ukraine as they go through this difficult situation. But I think it's going to be a huge effort for the World Health Organization, various non-governmental organizations to coordinate together and both help in any way possible with both materials and potentially to help in the health system and in the public health effort in Ukraine going forward. So it's going to take a big mobilization to try as much as possible to prevent some of these adverse complications from occurring. I believe the will is there on the part of the world, but there may be real challenges. We're seeing challenges in access to materials, for the Ukraine. So will there be able to be safe passage of medical materials to the healthcare system? We're seeing apparent targeting of civilian areas. That would be a very important thing to try to get agreement on both sides to stop. So, I think there's a lot the world can do, hopefully, to de-escalate the conflict, but also to then support the Ukrainian people and the Ukrainian health system.
Thank you so much, Dr. Mann, for your time.
Sure, you're very welcome.
非常感谢乔治城大学传染病专家、医疗产品获取安全和管理中心主任杰西·古德曼的分析和点评。来宾发表的都是个人意见，并不一定代表美国之音。感谢您收看《时事大家谈》，我是叶凡，下次节目再会。